The hip joint is also known as the ball and socket joint, where the ball femoral head of the thigh bone fits into the socket acetabulum of the pelvis bone. Femoroacetabular impingement, FAI, is a condition in which the bones of the hip joint grow abnormally and do not fit together properly. This leads to restricted hip movement and increased friction between the ball and socket of the hip joint, resulting in damage to the joint. FAI can be associated with labral tears, cartilage damage, and hip arthritis. The condition is also known as hip impingement. Femoroacetabular impingement occurs due to abnormal growth of the hip bones during a child's growing years. People with the condition who are physically active and involved in certain sports such as cycling, ballet, martial arts, golf, soccer, baseball, and deep squatting activities may experience symptoms earlier than those who are less active. Signs and symptoms. Symptoms of FAI include groin pain, hip pain, or low back pain. You may have severe pain while turning, twisting, and squatting. You may experience a locking or clicking sensation within the joint and pain after sitting for extended periods. Treatment. Non-surgical therapy. Initial treatment involves resting, avoiding activities that increase pain, taking pain medications, and performing specific exercises to improve hip movement and strengthen the hip joint. Surgical therapy. Your physician may recommend arthroscopic hip surgery if non-surgical therapy fails to improve the pain. Hip arthroscopy is a minimally invasive surgery performed through tiny incisions using a special viewing instrument called an arthroscope and special surgical tools. During arthroscopy, your surgeon can repair any labrum or cartilage tears, remove bony bumps, or trim off damaged or abnormal parts of the hip bones, facilitating free movement of the hip. Arthroscopy is much less traumatic to the muscles, ligaments, and tissues than the traditional method of surgically opening the hip with long incisions.
A total hip replacement is usually done when severe damage from arthritis or injury has made it difficult to perform daily activities. During the procedure, the femoral head and acetabulum are replaced with artificial components called prostheses. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. Your surgeon will begin by making an incision overlying your hip, separating the muscles and ligaments to expose the joint capsule. After incising the capsule, your surgeon will dislocate the femoral head from the acetabulum. He or she will remove any damaged cartilage or bone in the acetabulum, reshape the acetabular socket, and secure the acetabular prosthesis in place using special cement or screws. Turning next to the femur, your surgeon will remove the femoral head, shape the remaining femur to fit the prosthetic stem, and secure the femoral component using cement or other techniques. Once both components are firmly in place, your surgeon will slide the prosthetic femoral head into its acetabular counterpart, test the movement of your new hip joint, and verify that it is properly positioned with an X-ray. Your surgeon will then close the joint capsule, repair the muscles, place a drain in your hip to remove excess fluid, and close the incision with stitches or staples.